Hello, everyone. Good evening. My name is Dr. Alexander Dydyk, and I'm here to discuss with you treatments for knee osteoarthritis. I'm the Director of Pain Medicine for HealthyU Clinics. I'm a board certified family medicine, sports medicine, and pain medicine physician. Also, the diplomat of the American Board of Obesity Medicine. My entire goal is to get you up and moving and healthy and kind of focus on your wellness. We're going to be talking about the most common cause of knee pain tonight. That is knee osteoarthritis. This is commonly seen as we get aging, and it's a degenerative process. I don't have any disclosures for today's presentation. The outline we're going to talk about, first we're going to define the osteoarthritis. We're going to be talking about pharmacological and non-pharmacological options. So we're talking about medications, we're talking about injections, we're talking about therapy, we're talking about various interventions we could do, also some natural and regenerative products that we can use as well. They can be very useful to treat knee pain as well as improve function. So what is knee osteoarthritis? Knee osteoarthritis is a degenerative disease of the joints. The knee joint is covered by cartilage. And you can see this on the presentation of someone's knee. The bone is covered in kind of a smooth layer that kind of helps the knee kind of move kind of back and forth, helps it glide. And as we get older, that cartilage degenerates. It kind of wears down over time, and those bones get kind of closer together. As well as some other changes that happen within the knee. And it can become painful, it can reduce kind of motion. And that's why I see a lot of patients in my clinic who develop knee pain as they age. Now, you might hear about, part of the reason why you're watching this is because your knee hurts and you're getting a little bit older. So it is an expectation as we get older that there will be some degeneration of our joints. The knees do degenerate over time, just like kind of everything kind of wears and tears as we get older. The severity of the amount of arthritis does not really mean that you're going to have pain. So you can have really mild arthritis and have very severe pain. You can also have very severe arthritis and have no pain whatsoever. Ultimately, what matters is the amount of pain that you're experiencing and how much function it's reducing. The one thing you can imagine, if you're looking at the slide right now, the worsening of the amount of arthritis means that space is narrowing and becoming more severe. And you can imagine, as there's less space, your knee might not move as well. So there might be more swelling, decreased range of motion. These kind of things are more likely as the severity increases. But again, that pain really doesn't kind of correlate too much with the degree of arthritis. So what are the symptoms that you might be experiencing related to knee osteoarthritis? You might have some pain, you can develop swelling or feeling of fullness, kind of cramping in the knee, again, the loss of motion. There's kind of a grinding feeling. That's called kind of crepitus. People will have that where they can hear their knees kind of move. You can develop some weakness as well in the knee over time as well. And that's a lot of times because the muscles around the knee, when you have a lot of pain, aren't working the best as we want them to. So we're going to transition talking a little bit more about kind of the different kind of treatment options. So we're going to start with kind of bracing. Now, people can use kind of braces. Sometimes even just a little bit of compression on their knee can be helpful. And depending on where there is arthritis, if it's around the kneecap or of one side on the inside of your knee or the outside of the knee, it might be beneficial to have a brace that might be focused on the kneecap, like the image on the left, as well as something that can help with maybe one-sided osteoarthritis, like the knee brace in the middle. That's called an offloader brace. So one of these braces is just a knee sleeve on the left, on the right is a patellar brace, and in the middle it's what's called an offloader brace. But what those things can do is really can help improve your function sometimes, improve some motion, and again, they're there for pain relief. Ultimately, osteoarthritis is a degenerative process. It is not reversible per se. So that degeneration occurs over time. And as it occurs, that joint space is lost. Now, that doesn't mean there isn't anything to do about improving your function and pain relief. But a lot of times what we have to do to improve that function is try to maximize the amount of motion that we can have in our knee, as well as improve strength of the muscles that are critical to the motion and function of the knee. So physical therapy and home exercises become really, really critical to maximize what we have available to us, to maximize how well that knee is working. So the front of your knee, the big muscle that sits on our legs, is called the quadricep muscles. The muscle that's kind of behind the knee, that's really the hamstring muscles, and even the gluteal muscles, the buttock muscles, are actually really critical in terms of motion of our hip as well. So the combination of these muscles do kind of weaken over time. They fatigue very early, which also makes it more painful to move. And if you think about this when you're walking, we take a step, you feel impact on your ankle, and it transmits all the way up into your foot, goes to your knee, goes to your hip, goes to your back, and that's when we take every single step. And if we don't have a lot of good kind of lean muscle mass kind of there to kind of take that load, your joint itself is going to take the majority of the impact when you're walking, and that can cause a lot of pain over time. As well as if those muscles are fatiguing very quickly, then it's also becoming an area of concern because then your motion and strength is limited. And ultimately, what we care about is you being able to do the things you want to do. So that's something you see quite a lot is fatigue quickly, or anytime they have some event or any kind of exercise, they're afraid. And the reason why you get that way is over time those muscles do fatigue, and a lot of times the primary reason why this has occurred is because that arthritis is painful, and now the other muscles aren't working to the way we want them to, and now we change the entire way we do things in our home, and that's ultimately what we're trying to avoid. So just as important as improving the muscle's function is, weight loss can be also a really critical part of this as well. For every pound that we gain, it's about 4 pounds on the knee, and the opposite's also true. So if we lose 10 pounds, we're going to lose about 40 pounds of pressure being put on our knee. So I'm also a director of weight loss at HealthyU Clinics, and part of that is saying, how do we help you holistically and kind of a broad kind of approach to maximize, again, all of the parts that make up you, right? So if our knee is really bothering us, and we are saying, how are we going to be able to help this process along? Losing weight is actually a really critical component to that as well. That can be an excellent adjunct to treatment as well, going on with medications and therapies and things like that too. Ice, heat, compression, these things are seem kind of sometimes straightforward and things that we're told to do, but often we forget about them, but they can be very effective, right? So if something is just swelling up and it's been, let's say the knee is starting to bother you again, sometimes ice is really useful. A lot of times within the first week of being used, and let's say you're cramping up in your knees kind of over time, and this has been an ongoing kind of problem, it becomes a really useful as well. Compression itself, like we talked about with the pricing, can be useful. And even just elevation, if there's a lot of swelling in the knee, can be helpful too. So there are a multitude of different medications. I still get questions kind of every day about what can we do to kind of maximize kind of pain relief, even just from over-the-counter medications. So I talk to patients about, what is over-the-counter? What can we pick up? What are these things? So, we talk about regimens for Tylenol. We talk about regimens for anti-inflammatories like aspirin or ibuprofen or naproxen. There's topical medications like Voltaren gel or Biofreeze, even using topical kind of patches like Salonpas. So these are different kind of modalities that are really worthwhile kind of knowing, because then things get a little bit more complicated when we talk about some of the more prescription drugs and injections and things like that too. So there are a series of different prescription medications that we talk about too, some stronger anti-inflammatories. There are some multiple different prescription non-narcotic, non-opiate medications that are FDA, so Federal Drug Administration, indicated for chronic musculoskeletal pain. We hear about Cymbalta, we hear about Effexor, some medications that can be helpful for pain that has become chronic, like gabapentinoids. There's some stronger formulations of topical medications that we use as well, and even making these medications at a compound pharmacy that have increased concentration. And then also there is a role, it's not the first line thing that we go for, but there are stronger narcotic pain medications that we use sometimes as well. Again, the most important thing when we're talking about is I don't want patients to feel like they are stuck, right? So if we say we don't have any pain as long as we don't move and we don't do anything, that's not really a good quality of life, right? So the goal is if we can get you doing the things that you want to do in your home, that's the most important thing. Everything after that point becomes secondary. So we talk about risks, we talk about benefits of various medications, we talk about what are the side effects, and that's how we make decisions together. Also, a really hot pressed issue kind of moving forward now is how do we incorporate things like CBD THC, so these various psychoactive and non-psychoactive components of marijuana. So CBD has none of the feelings that people get from marijuana products that can make them feel high or altered. THC is the main component of marijuana that would have those components. There is a whole conversation we have about in the state of Arizona that there's recreational marijuana products as well as medical marijuana. We have those conversations as well. We talk about dosing, we talk about titration, we talk about various indica, sativa, hybrids, different strains, this kind of stuff, as well as the ratios to kind of maximize these things. It's becoming more and more in favor to kind of reach for the marijuana products, even before we reach for some of the narcotics and opiates for refractory kind of pain as well. And so this is always an option. And even at HealthyU, we have a few kind of products that we can sell as part of our multitude of different natural products we have as well. Injection care is kind of standard when it comes to the treatment of chronic knee pain and knee osteoarthritis. And there's a series of different types of injections that can be done. The most common kind of thing that is talked about is knee injections with corticosteroids. So we don't want to do steroids over and over and over again because it can wear down the joint, but it can be very, very helpful to kind of calm down an exacerbated or irritated joints. So let's say we were moving or doing some yard work and our knee became really irritated. It's been going on for a few weeks and we can kind of pinpoint when that time started. A lot of times the steroid injection is really useful for that. I also see a lot of patients who say, oh my God, I'm going out on vacation, going on a cruise, and I know I'm going to be doing a lot of walking, and sometimes a steroid injection can be really helpful in that sense. We also do sometimes different injections with anti-inflammatory, so you hear something like Toradol, that can also be injected into someone's knee as well. So if we're not looking for these kind of systemic effects of steroids, that's an option as well. And then hear about viscose supplement injections. That's like the gel shots that people get. There's a picture of Supartz on the screen, which is a very commonly kind of prescribed gel shot. It's kind of an artificial kind of joint fluid lubricant that can be used. I would say about 50% of the patients that I see really enjoy and think that's a really useful kind of tool. So I have patients who really, really stick by kind of viscose supplement injections, and some patients say that's not the best thing for me, right? Prolotherapy is another type of injection that we do. It's actually a concentrated like sugar saline kind of mixture that can kind of flush out the knee joint and kind of help kind of calm down the environment within the joint as well. And then we'll spend a slide too talking about regenerative therapies as well, and those are injectables. Regenerative therapies usually are after some of these other treatment options that we'll talk about, but they can be really useful. So something like platelet-rich plasma is a component where we kind of do a blood draw, we spin down the blood, we then take out the basically kind of growth factors and healing factors and re-inject those back into something like a joint. Can be another tool that we can kind of utilize in the scheme of the different things that we do where it fits. It's tough to say. The research is kind of mixed on it for the most part, but these are options that are out there, and it's something I do discuss often with patients, and it's something they're interested in as well. Now we're getting into some of the more interventional kind of components of knee osteoarthritis, when we're getting past a lot of times failure to improve with things like physical therapy, injection care, if we're looking at medications and kind of determining, hey, do we need to go with stronger pain medications, or do we want to go down a different road and try something that might be a more permanent solution or semi-permanent solution? So one thing that has a lot of great evidence that's out there now is basically thermal ablation. So it's radiofrequency ablation of the nerves around the knee. What this actually does is every joint, every part of our body senses pain from nerves. So these nerves sometimes don't do anything else other than sense pain or not. So the nerves in the knee are called the genicular nerves. There's kind of 3 or 4 kind of main ones that we are targeting. And what you can do is you can actually burn these nerves with a probe that we do in our procedure suite. And what that can end up doing is taking someone's pain away for over a year in some cases as well. And what's very interesting about this is that any nerve, or most nerves in our body, honestly, can be burned in some capacity if it's the right person, if it's the right area of their body. We don't do that lightly, but it's also a really amazing tool. I see it for both patients who have knee osteoarthritis who are, let's say, actively trying to avoid going to a knee replacement, and I also see it with patients who have had knee replacement and have kind of persistent pain afterwards too. And we usually start this process by doing what's called a nerve block. So we actually numb these little nerves in someone's knee first, and we see how much pain relief it takes away. Because essentially, by putting numbing medicine up against these nerves, you're essentially doing the same thing as what the burning would do. The problem is the numbing medicine wears off in a day or so. And so what we want to do is something that lasts much longer. So if you burn these nerves in someone's knee, you can get over a year of pain relief. Now, what happens is the nerves kind of grow back over time. And so something like that can be repeated if necessary. There's also options to freeze nerves. And so the freezing of the nerves is another option that can be utilized. Sometimes it's really based off of patient's insurance, really, to see which pathway is the best. But ultimately, if we're doing that, the difference between the thermal kind of burning of the nerves and the freezing of the nerves is the freezing of the nerves can last about 3 months, and the burning of the nerves can last for over a year. It's a little less invasive to do some of the freezing of the nerves as well, so we have that conversation sometimes as well. Oh, went too fast, going back one slide. Another thing that can be really utilized and really effective for patients is peripheral nerve stimulation. So there are multiple different ways to treat knee osteoarthritis when we're focused on specifically these nerves, like these genicular nerves that we were talking about. There's also other nerves that can be targeted, like the femoral nerve, the saphenous nerve as well. Now, these nerves that sense pain can also be stimulated. And stimulation is a way of blocking the pain signal that goes from the knee up to the spinal cord and then to the brain. So if you block the pain signal, it's very similar in some ways to burning it, where it's not able to transmit that interpretation of pain. Meaning, if I stimulate this, you might not be able to sense pain anymore in that area. There is a 60-day trial where it's actually a tiny probe is kind of put near where these nerves are on someone's knee. And that's done in an outpatient kind of setting or in a surgery setting. And then that can stimulate those nerves. Once those nerves are stimulated, you can go about doing your normal activities. And what's interesting is there's actually a very large population that have persistent pain relief after this kind of 60-day trial period. Let's say someone has persistent pain beyond the 60-day trial, you can also do things that are permanent options. And one of the options that's on the slide is from Nalu, where there is a generator that's put underneath someone's skin near where those nerves are. And you can see it's about the size of a dime, too, that can be kind of utilized. So these are different kind of peripheral nerve kind of stimulators. These are options that can be also utilized. It's usually a lot of times farther down in the process, but it can be kind of used in conjunction or even before something like ablation, depending on what the patient would prefer. Another useful modality that can be utilized specifically if a lot of these other options have failed is something like spinal cord stimulation, or it's called in another form of spinal cord stimulation, which is dorsal root ganglion stimulation. Big names, but essentially similar to the peripheral nerve stimulation, you stimulate the area of pain that interprets knee pain in someone's back. Let's say that again. So if you have pain in your knee, there's a signal that goes from your knee all the way up to your back where your spinal cord is. There's an area within your back that senses knee pain, right? It's almost like you've got a computer in your back. This is the area where there's knee pain. That signal from your back goes to your brain, and that's how we interpret kind of pain, essentially. So we could block or stimulate that signal in someone's spine, and by doing so, it can relieve someone's pain. These options are options. A lot of times we move towards these options more in cases for patients who are not good candidates for something like a knee replacement, have had significant pain following a knee replacement, so chronic pain post-surgical. And so those are two different kind of categories of patients, but there are multiple patients that may not be good candidates for surgery and a knee replacement and the recovery process of that if their pain is persistent. And we can treat that knee pain very effectively with spinal cord stimulation as well. So again, the whole goal of all of this is to improve function. The whole goal is to be able to get you back on your feet and be able to do the things that really matter to you. There are some natural pain relievers I want to talk about a little bit as well, just so we're very kind of inclusive, kind of looking at all these things too. some of these things are very commonly kind of taken by patients and the like. Fish oils have anti-inflammatory properties. There's different supplements. SAMe is another supplement that's very commonly used. It's actually similar to Tylenol in some ways. Turmeric is very infection to be utilized again, similar to other anti-inflammatories. Reducing the amount of inflammation in our diet and doing anti-inflammatory diets. I've had patients who have a lot of success with that, and their joint osteoarthritis is definitely influenced by that. And then things like glucosamine and chondroitin can also be kind of utilized. They can be helpful for pain relievers sometimes in certain doses. And last but not least, surgery. I'm not a orthopedic surgeon. We work very closely at HealthyU Clinics with knee surgeons across the valley. Knee surgeries are very effective in the treatment ultimately if other measures have not been successful. But as I mentioned before, there are some candidates who are patients that aren't great candidates for knee surgery. And for every surgery, there is a portion of the population that has persistent pain afterwards. So I see patients from the beginning of their knee pain all the way up to surgery, and a lot of times after surgery as well. It really just depends on the case, but ultimately our goal is to take care of patients no matter where they are, if they're preoperative or postoperative. And this picture on the screen is a picture of what it ultimately can look like and what we're talking about with the prosthesis. Generally speaking, as we get older, most of the cases are what's called total knee replacements, where the entire knee joint is replaced. And closing thoughts. So our goal, kind of HealthyU, is to take a holistic patient-centered approach to treating pain. Our goal is to get patients back up on their feet and do the things that matter most. And thank you for your time today.